So do you operate on that or don't you? The point I was going to bring up in terms of the MRIs is literally you could MRI every patient who walks into this office, right from the age of 18 to 100. And I think the statistic is somewhere between high 80s to 95% of those patients will have some kind of disc. Let's call it disc pathology. So they'll have some kind of disc bulge, some kind of derangement in the disc. Most of those patients are completely asymptomatic, and yet the MRI will demonstrate some kind of disc pathology. That without a shadow of a doubt, just about every single one of us have some kind of disc bulge. Is it relevant to your back pain? Is it relevant to your symptoms where we need to delve further? Now, you can look at an MRI scan, put it up there, and there's this disc that absolutely, completely is radiated and is almost obliterating the nerve coming out of one side. You would panic and you say, that needs to be operated on immediately. Otherwise, that nerve is going to be permanently damaged. That patient may have no symptoms whatsoever. So do you operate on that or don't you? They're functional and they don't have any symptoms. So why would you go in there and operate on it? There are a plethora of stories of patients who've been operated on for that reason, and clinically you cannot associate that disc with their symptoms. So we go in and operate on that disc, clean it all up, successful surgery, and yet their symptoms haven't changed. So was that disc even relevant to the conversation here? So their symptoms. But that's a difficult one. And often that scenario pops up. So we need to find out what we need to do to ascertain 100% that that disc is related to their symptoms. And if there's not that correlation, both clinically and through scans and imaging, they correlate, then you must not operate in that disc. There's no reason. In the same breath, you could put out another MRI and you would need the most vivid imagination in the world to see the tiniest disc bulge, and yet they have florid symptoms. And the clinical findings and the florid symptoms pertain to that disc.